If you've seen your eyes tiredly looking, if you've noticed loss of volume that creates a deep halo under the eyes, if you've seen your skin crepey, if you've noticed dark circles, or you just want to improve the fine lines, then you should keep on watching this video. My name is Eli Pavlova. I'm a medical cosmetologist, aesthetic trainer, and also co-founder of EGP Aesthetic Clinic in London. There are some normal aging process that influences the way the skin around the eyes looks. But there are also some external influence. The normal aging process, it will be the decreased collagen production of the skin. It will be also the loss of volume that creates the halo. The fine lines is part of the normal aging process. But as I said, the external factors are also influencing how the skin around the eyes looks. The external factors, obviously the sun exposure, which is damaging the skin and is also decreasing the production of the collagen, but also the long stay in front of the computer, the long exposure of the face, the eyes as well, in front of the screen. So how we refer when the client comes to us, this area, the area around the eyes. First and most important, it's to have a thorough consultation with the client to find out the individual needs and also to find out what is causing it. In some cases, when the individual needs of the client are just to improve the texture and the quality of the skin, we will focus on the skin, of course. How? With some individual treatments. First, it could be the mesotherapy, specifically made for the under eye area, for the skin for the under eye area, not only actually on the under eye area, but also on the upper lid as well. This is a cocktail of amazing ingredients. Most of it is non-cross-linked hyaluronic acid combined with vitamins, minerals, peptides, some proteins which are gonna stimulate the skin, will increase the collagen production, and also gonna hydrate the skin and make it look plump. Another one, it will be the plasma treatment that we have many videos about it, but it could be made just specifically for the eye area. The plasma, it will improve again the texture, the quality, the collagen production. It will speed up the healing process and also will making the small injuries and applying the platelets, that will stimulate the skin. The skin after a month is going to look fresh, hydrated, also very, it's going to get rid of the little fine lines. All of this could be also combined with the small doses of neurotoxin. The neurotoxin, of course, will go, it will go to the muscle, because the muscle around the eye, it's a depressor muscle, and which means that it's pulling down. Once when this muscle is relaxed, that will make a good lift, which will improve the appearance of the fine lines. The neurotoxin also could be used superficially on the skin, and that will improve not only the fine lines, but will improve the texture. It will improve if there is some redness. It will improve also if there are larger pores in this area. Some people have. When the needs are slightly different, when a client comes to us and wants to improve the lost volume and noticing the lost volume, which is leading to a halo or sunk eyes, which most people were noticing on the reflection of the mirror, or they're noticing on the pictures, then we will use our signature 3-step mesotherapy filler that will also, it will work 360 degree. It will improve the skin quality and the skin texture, and then we're gonna restore the lost volume with the fillers which are specifically made for this area. In our signature 3-step MesoFiller for the eyes, first we will improve the quality of the skin. In most cases, that's very important to start with, because the skin sometimes is very fine, very crepey, and it's not strong enough and it won't support when we place the filler. And this is why when you see in social, for example in social media, or when you search what treatment would be best for you, how to treat the under eye area, you've seen some complications like migrated filler. In most cases, the migrated filler is when the filler is straight away applied to the hollow, but the skin hasn't been supported initially. So in our clinic, we first start with improvement of the quality and the texture of the skin to make it strong enough, so once when you have the filler, just to support so well that you don't have any complications after. The mesotherapy could be also combined with some mesothreads which are applied under the eye, and that of course will, in a combination of both, we will achieve a great result to not only of course to get rid of the water retention, but also to improve the quality of the skin. A course of treatment is required when we want to improve the skin texture and the skin quality. So this will be of course discussed on the assessment, how many treatments are needed, and also when it comes to the hollow, of course, our signature 3-step MesoFiller, then you have the treatment separated in 3 visits, but also we will advise you to do maintenance once in a while to just boost the skin around the eyes. I hope this information was very useful, and I'm sure that many of you want to find out what individually they need. Is it just to improve the skin texture? Is it to improve the hollow and the skin texture? Or maybe just some neurotoxin to have a little bit of a lifting around the eyes? Make sure you book yourself for our video face-to-face consultation. We will make an individual program for you. We'll answer all of your questions and send it over via email so you can read it as well. I'll see you for more tips on how we can improve our skin in our next video. Thank you for watching.